Just stay right there, Ms. Tracy, and we'll go to item 6, resolution by the county of Richmond to direct the expenditure of opioid settlement funds. If you're gonna help us with this one too.
Yes, sir.
All right.
So, sorry, I'm trying to get back and forth. So the first one is the collaborative strategic plan, and we have a resolution requesting $86,329 for this. This is a reduction from what we asked for last year. We did not need the entire amount that was requested last year, and so we've reduced this request. This covers a part-time coordinator that assists with the different work that we do with the opioid grants and monitoring them. It also pays for part of the salary for the person who keeps up our website and the information that we share on there, and that the secretarial duties that are done to put out the RFP and to the reviews and things that we do on this.
Any questions, Commissioner?
Teresa, this only deals with the funds for administrative purposes and cost and does not impact the funds that are set aside for the grants, is that right?
That is correct.
Okay.
This is a separate, the only thing that would not be specifically administrative is like if we're paying to run brochures to share in the community. We're required to do 2 meetings a year with community leaders and things like that. So there may be other expenses, but it does not affect the grants.
Yeah, I think my concern, and probably the board would share this, is that we just want to make sure that those grant funds are available for local entities to help our folks that are addicted as part of this opioid crisis, so thank you.
I'll be sharing several more of those in a minute.
Okay.
Commissioners, on the resolution, do I have a motion to accept the resolution?
Motion.
Second.
Have a motion and a second. All in favor, please say aye. All opposed? Commissioners have approved the resolution.
Mr. Chairman,
Mhm.
they're all, they wanted them all in one item, so you got like 3 or 4 other ones, resolutions,
Okay, all right,
so we're just gonna do that one.
at the end,
Mhm.
okay.
Okay.
All right.
The next resolution is for $40,000, and this is for the purchase of Narcan for community and county first responders. And this is also a reduction for what we asked for last year. We did not use all of the funds that we had requested last year, and so we asked for a smaller amount this year. Any other questions about
Any
that
other
one?
questions on that?
Okay. And the next one is for $99,503, and this is for Samaritan Colony Recovery Support Services. This is the exact amount that they received in the fiscal year 23-24, so it was their first allocation, and then 2 other times the board approved additional allocations for them. So this is a request for the same funding that they received last year. We are right at the end of their fiscal year. They were receiving money, and I think when we met in May, the end of May, they only had 3 or 4 participants left to serve for Richmond County to meet their annual agreement. And so they have done very well with providing those services for Richmond County residents. Any questions about that one? Okay, and the next one is for $75,000, and this is for First Health peer support. This is an increase from what they received last year. Last year it was, I'm sorry, I don't remember the amount off the top of my head, but it was around, I think, $50,497, if I remember correctly. And we did not give any additional allotments to them last year. There was some change in staffing, and they were not able to complete the closeout that we requested of us gathering information on time for us to make any recommendations. So it was recommended that that be given to Samaritan. So we are recommending to give them an additional just under $25,000 for peer support to increase the hours that they provide in the community for peer support services. Okay, and the next one is for 48,000. Well, I think this other one, the other has already been approved, if I'm not mistaken. I don't have a copy of the proposal for the jail. Yes, I'm sorry, it says it was approved in May. You've already approved that, but we added it in our numbers just to show the total amount that we would be expending this year. And that was 48,671. And then the last request that the Drug Task Force is making is that we offer 2 new RFPs that we have the RFP ready to go out. I brought copies in case anyone wanted to see a copy of what would be going out. If this is approved, we will be emailing this out to the Drug Task Force, to partners who have already contacted us asking to apply the next time that we offer an RFP. It will go on the county website and the newspaper. So all of that will happen tomorrow if this is approved today. We need to post that for 30 days, and then we will go through our process of reviewing and interviewing and making recommendations and bring that back to the commissioners. We are recommending that we open 2 RFPs for $75,000 each for a total of $150,000, and that would bring the total that we are looking to budget for the 24-25 year at $500,000.
Are there any guidelines in there that tell the possible recipients, what the task force is looking for and what they might not be doing to receive?
It's not as much specific to the possible recipients, but we have what's called Exhibit A to North Carolina MOA that's provided to us that says the categories that the proposals have to meet, and that is included in these. And should I leave copies for y'all of this or something maybe? This is the actual RFP that will go out, and I have a copy for each of you here that I will leave for you. And it should give that same information in here, but there are 12 different categories that the opioid funds are to be spent on, and so it tells what those are. So as we're reviewing those, we are trying to look at areas that maybe we haven't been growing, or maybe this time somebody will offer RFP for a different program that we're not already offering or already seeing in our county. And so the Drug Task Force reviews them to see, we do a lot of different surveys and gather data, and so we sort of are looking at what the issues are in our community and what kind of programs we recommend that would help with the issues that we're currently seeing.
One other thing, I know we spoke with Robbie once about some data, maybe gathered to show what these programs are actually doing so we can have a better idea of where the money's going.
Okay.
I mean, I get the meetings for the task force, but it'd be nice to see a larger picture.
Sure, and I'm sure that's available. We evaluated both programs twice. We evaluated them mid-year before we made the recommendations for any further funding, and then we're right at the end of this year, and so we'll be doing a second audit on them. And so some of the data, like where I said that Samaritan Colony was right at completing the number that they agreed to see, and that's including what they agreed at the end of the year, and each time we gave them more money, they agreed to a new amount to serve. And so they report out each month at our Drug Task Force their numbers and how many they're serving, and then we also do the audit where we gather all that information, so I'm sure that we can provide that.
Thank
Yes, sir.
I knew that first up, Dr. Gilliman moved away, so I'm guessing that part of the funding for them has shifted to cover a different area of their project, or how is that?
Not any of the opioid funds were specific to fund anything there. I know that there were peer supports that I think were reassigned to other areas, but there was not any opioid funding grants that were given specifically to that office. It was just to the 2 I said, and then we had Samaritan and First Health for those 2 programs, and we had also originally awarded a grant to the, cooperative extension, but they withdrew, due to staffing. They were not able to staff the position that they had intended to use. So that was the 3 grants that, we recommended and the commissioners authorized last year.
So tonight, you're doing the resolution for us to approve. What of all this does this include? Does this include all the 500,000 total that you just mentioned, including the 2 RFPs?
Yes, sir, except for the one that was approved in May. Everything else, we have copies of resolutions and the request for the RFP to go out tomorrow.
Any further questions, Commissioners?
Is this a fiscal year from June 30 to July 1, Mr. Garner? How do these grant funds?
July 1 to.
Just exactly opposite of what you said, July 1 to June 30. Yes, sir.
And all of the money that was approved last year has already been paid out. Except for that I said that we did not spend, it didn't take the full amount that you authorized, and so that is still in the account. We did not touch anything that we did not, have the need to spend, as in the Narcan, where we had enough Narcan available and did not need to buy any additional, and the, strategic planning, that we did not use that whole amount.
Commissioners?
Motion to approve.
Okay, good. Do I have a second?
Second.
I have a second. All in favor, please say aye. All opposed? Thank you, Commissioners. Thank you, Commissioners. Appreciate it.
I will leave these.
Yeah, you